Modern medicine classifies uterine fibroids as localized leiomyomas, smooth muscle tumors to be managed or removed. Traditional Chinese medicine approaches them through a different lens. The foundational rule of TCM pathology states that anything moving freely does not form a mass. These growths, known as zhengjia, represent a long-term accumulation of stagnant substances. They are the physical result of materials that should have circulated, but instead condensed inside the uterus. This sequence traces how invisible energetic shifts eventually become visible matter. It begins when stress or cold impairs the movement of qi. Without that motive force, blood circulation slows. Fluids then thicken into dampness and phlegm, providing a binder. Over years, this stagnation solidifies into the physical structure of a fibroid. This solidification marks the point where a broken internal environment manifests as a structure the body can no longer circulate or transform. The liver system acts as the body's primary regulator of flow. It governs the smooth movement of qi, the regulation of emotions, and the rhythmic circulation of blood through the pelvic cavity. Chronic emotional suppression, frustration, or internalized anger acts as a physical blockage. This emotional tension drops into the system like a dam, halting the smooth flow of qi in the pelvis. Once the current dies, sediment settles on the riverbed. This is blood stasis. In the body, this manifests as dark menstrual blood, clots, and a fixed stabbing pain, the hallmark sensation of blood that has stopped moving. In traditional Chinese medicine, phlegm refers to pathologically thickened material created when the body fails to properly transform fluids. When spleen qi is deficient, fluids accumulate as dampness. This dampness thickens into phlegm, acting as a cement that binds the blood stasis together. This combination creates a sense of physical heaviness, abdominal bloating, and chronic fatigue. Consider a patient with a history of chronic stress and intense PMS. Her periods involve dark menstrual blood with large clots and a fixed stabbing pain in the lower abdomen. Based on those specific signs, which pathology is driving her presentation? The dark clots and stabbing pain confirm blood stasis, rooted in the blockage of liver qi. When this stagnant mud and phlegm sludge combine, they create the stable environment required for abnormal tissue to thrive. Once stagnation is present, the internal temperature of the uterus further dictates how the mass forms. Both extreme cold and heat result in fibroid growth, but they operate through opposite mechanisms. On the left, we see the pattern of cold. The classical TCM view is that cold coagulates blood. Like a frozen river, it constricts the vessels and brings circulation to a total standstill. Cold-type presentations involve severe menstrual cramps that improve with heat, pale clots, and cold extremities. Contrast this with the heat pattern. Here, the stagnant terrain is boiling. This increases tissue activity, inflammation, and vascular congestion in the lower jiao. These patients present with heavy, bright red bleeding, irritability, and signs of pelvic inflammation like thick yellow discharge. Differentiating temperature is vital for treatment. Giving cooling, anti-inflammatory herbs to a cold-type patient would only further freeze the circulation and worsen the accumulation. From a TCM perspective, surgical removal has limitations. If the mass is dredged out while the dam remains and water stays frozen, a new mass simply grows. TCM alters the terrain by restoring flow, warming cold, and clearing dampness so the body transforms tissue naturally. Use this Sung-Jia cheat sheet to map pathology. The top row tracks the 6 steps from initial energy impairment to mass formation. The bottom matrix breaks down the 4 foundational patterns: liver stasis, spleen dampness, cold coagulation, and heat inflammation, listing their hallmark clinical symptoms. Healing is not just about the removal of broken tissue,